Okay, quick update. It's been a while since I made my last update. I just wanted to talk about my last scan, which was approximately a month ago now. So I've been a bit slack with this update, so apologies for that one. Um, you can probably tell I'm really happy. I had, well, to explain what happened with my scan, um, yeah, as I say, it was approximately a month ago. I felt pretty confident going in, but obviously still quite apprehensive because it's one of those things where you realize just how unpredictable, and you just know from past experiences how unpredictable and scary this kind of cancer is. It can just take someone in an instant. So, um, and within the space of 6 months, you can get this change, even if this very quick change, even if symptomatically you're feeling fine. It doesn't always correlate. So I was feeling really good. I was feeling really confident. Symptomatically, I felt better than I did before, but I always had this nagging thing in my head. What I was then to experience was very interesting in terms of the scan. I did my usual routine where you write all your details down. You tell them that you're not a bionic man, that I don't have bits of metal that weren't in there before that would just make me stick to the machine or blow me apart, I guess, before going in. And you just confirm all your details so they know it's you. So what then happened was really interesting. As I say, I had my usual routine. As per usual, I went into the room with the nurse after they put my cannula in for the contrast injection. I then lay on the table to go into the MRI. It was MRI spectroscopy. So MRI spectroscopy is looking at biomarkers within the microenvironment, within the area of tissue in the brain that previously showed activity. So over time, we've been looking at how my ketogenic diet, my metabolic approach in general, has been influencing those biomarkers that we were able to see over a course of a period of time. There's a motorbike out there. Can get quite noisy around it. But anyway, we've been seeing how my I was kind of distracted. My biomarkers have been changing over time as I've been on the ketogenic diet, to the great interest of my oncologist. As I say, I'm kind of going off on a slight tangent. Prepared for my scan. The scan started. It's a scan that usually takes around an hour. On MR spectroscopy, what usually happens is you perform a scan and then you're looking at, in my case it was this area between the temporal lobe, so side basically, and closer to the top, so between the speech and movement area, the parietal lobe, which is that one, and the temporal lobe, which is just kind of beneath it. So we're looking at that area where the tumor was, where the activity was previously shown. On my last scan, 6 months previous, so this would have been approximately 7 months ago, what we saw was no visible disease, but MR spectroscopy, easy for me to say, was still showing some sign of activity. And we weren't quite sure what that exactly means, but it's generally not fantastic. But because this activity was dissipating, I want to say. Not really dissipating, because you're talking about these metabolites and what's happening. So, yeah, I don't know what you'd say. But that activity was lessened. It was showing less on the scans. I always want to say things in a better way. I would sometimes find difficulty with the words, not because of any neurological thing, just because that's me. So, and I'm constantly thinking when I'm talking, so that distracts me. My brain's constantly buzzing, doing things, and I get high on ketones. So, yeah, just as I was saying, we've seen a gradual improvement in that. So less enhancement, less activity over time on the spectroscopy. Now, the last time there was no visible disease, but it was picking up some activity on the spectroscopy. This scan, I went 5 minutes into the scan, I was lying there. The scan's usually an hour long, so I was prepared. I was getting ready for sleep. I usually try and sleep in there, even though it's so noisy and you get quite claustrophobic. You try your best to relax and sleep. So I was getting ready for a nice snooze. And then just very rudely, I was woken up 5 minutes in before I could get to sleep. So not really woken up, but in that semi-daze. Yeah, I was just interrupted after 5 minutes of this hour-long scan. Usually they stop it halfway through for the contrast, I guess. Well, it depends on spectroscopy. Sometimes it's before. This time it was before, so I don't know what I'm talking about. But yeah, just after 5 minutes is very unusual. And he just got me out, and then I was quite scared, actually. I was petrified because I thought, this is really unusual. What's going on? As I'm, I'd say I'm an optimistic pessimist, so I always think of the worst possible thing and hope for the best, but I'm always thinking of the worst. So I was just thinking, oh, this is not good. I hope it's good, but it's not normal. So yeah, he just he got me out and just said to me, the radiographers want to discuss your scan. So that's why we've stopped the scan. And I said, okay, that's unusual, but okay. And then he just said, I said, what are they looking at? And what's going on? And he just said, oh, they just need to discuss something, and I'll let you know and get back to you. And then he just kind of left me there, and I was just thinking, oh, that doesn't sound good. I don't know what to think about this. And then after a couple of minutes, he came back, and he asked me, can you just confirm who you are again and your address? And I was just saying, okay, yeah, just, and then I confirmed it to him, and then he said, are you having any treatment at the moment? And I said, well, I'm not having any standard treatment, if that's what you mean, but I am doing a few things on my own. And he was just, he seemed kind of perplexed, but really happy for some reason, and he just said, well, the radiographers have decided to stop the scan because they just can't see anything on MR spectroscopy. And I just was taken aback by it, just because I thought, this is just so surreal, and it's just amazing. It's the most bizarre feeling, because I never thought I thought I might get to that stage, but I thought I might have to be more strict with things, because I didn't think I never think that I'm doing things in the best way that I could. I try and optimize my approach, but I'm constantly working on new things, and I still will. I'll continue to do that because I think in terms of a long-term success, I need to do that. Um, so yeah, I finished my scan after 5 minutes, and that was just a bizarre feeling. Then I said, "Can I still get the CD to look at the scan?" And he said, "Oh yeah, sure. It won't show it won't show you anything new, but well, it'll show you something new. It'll show you there's nothing there, but sure, if you want to have a look at it, you can." So yeah, took it home and had a look, and yeah, it showed no disease, nothing detected. And I saw my oncologist. I think it was the day after, or a couple of days after, and he was just delighted and said, "This isn't the typical response in the situation that you had when you had that active disease for an anaplastic astrocytoma. That's not what we typically see, and it looks like it's potentially, if you were diagnosed correctly, which we have to now properly establish. So we have to go back again and look at the tissue from the biopsy just that I had 3 years ago. So we're going back to look forward. We're going back to try and establish, just have a thorough examination of my medical notes, my tumor type, every little thing about it, and every little thing about what I've done, my treatment, the stages of treatment, every scan, looking at it very carefully, every letter, and trying to establish from all those variables, all that data, what are the things that I may have done to get the result that I appear to have had, which is a result that appears to be, because I'm not going to say definitively for anything because I don't like to do that, but what appears to be a remarkable result. We need to establish that because he has given me the opportunity to do some work with the team, some actual work in the lab. I don't know exactly what that entails just yet. It's to help devise the clinical trials for ketogenic diets, which we've been talking about for about a year already. So this is the first time it's practically happening. So on the 20th, I'll be in the lab getting this work into action. So actually doing something proactively where we're doing something. So we're not just talking about it, we're actually doing it now. And from my results, that gives us just a human case to show researchers to say this has potential. And even if you're questioning the management of the cancer, the management of the seizure activity has been again better than expected, because I went against the advice of 5 different neurologists who suggested I was just very irresponsible to even suggest decreasing my medication, let alone thinking about coming off it. Just the control of that has been just shown how effective my approach has been for that. And it's just hugely, just to have everything you've worked so hard on for so long, to be validated in that way, and to be greeted with such excitement and such enthusiasm for other patients, to try and apply these principles that may work for a number of tumours, because they're all different, I understand that, and they all respond differently to different metabolic protocols. So we need to establish what may work for at least the majority. So there are commonalities between different tumour types in terms of how they respond to different treatments, either in isolation or combined treatments. And that's what we're trying to establish. I have a number of ideas on that and a number of tests that I want to implement within those trials, cost-effective tests, which is very important when you're doing clinical trials. There's limited money available, and that would help to monitor, to give a baseline, and then allow to monitor the success, the effectiveness of these trials over a period of time, along with MR spectroscopy, which I think is a useful tool to use. Not all hospitals have it, but Charing Cross are fantastic with that, because most of my scans have been MR spectroscopy, easy for me to say, spectroscopy at Charing Cross. So I'm really excited that today I had a meeting early this morning at the Brain Tumour Research Centre at Hammersmith Hospital, based at Hammersmith Hospital, with Imperial College London. They work with Charing Cross, and we had some very fruitful discussions about how you would implement the ketogenic diet, what my role is going to be within that, what I can do in the lab, how we can progress forwards, what data we need to collect, what's been established already, what we know now. So what we know now, where we are, so what we have known, where we are, and where we're going in the future. So where we're going in the future is really, really exciting, and it's finally happening. So I'm really excited, and this year will be a huge year. And this summer I'm going to try my best to work really hard to make something happen. And I'll try and share a few things in the lab, because I think people sometimes don't see that. People think about cancer research, but they don't actually see what's going on. And I want to open up those doors and let people see through those windows. It's kind of like windows on a limo, or in one of those crime scenes, crime dramas where you can not a crime scene, a crime drama where they're trying to it's one of those mirrors where you can only see in one direction. I want to open that up so that people can actually see what research is going on and how it's happening. And I think that's really important, that transparency, because people put a lot of money into research. But I know that because brain tumour research has such limited funds, that the work that is being carried out is work that is appropriate. It's appropriate, it's non-toxic in terms of the work that brain tumor research do. It's something that is it's progressive and not regressive. But that way, progressive and not regressive. So yeah, it's definitely forward thinking. It's looking at non-toxic treatments within the metabolic theory of cancer, which is something that I definitely prescribe to. Prescribe. Yeah. So yeah, that makes me very positive, and the support that I've had from brain tumor research with my approach has been remarkable. So, and greatly appreciated. So, the fact that they've asked me to get involved in this way and that they're so supportive of me is really nice, and I'm really excited about this. So I hope to update you in future about that, and yeah, I guess that's me done for my update today. Like I said, I'm really excited about getting stuck in the lab. So it starts on the 20th. So I've got, how long have I got? Like a week, I guess. 2 weeks. 2 weeks and 3 days. So yeah, I'll let you know how that goes. And that's me done. I'll have a nice weekend, I think. The sun's going to come out, so I'll do some nice sunbathing, and that'll be nice.